Your average kid in the affluent neighborhood will have access to the best doctors, the best facilities. They actually don't even have that much disease, or any disease for that matter. But the kids that are actually deep in inner cities, in areas where you have this epidemic going on of chronic diseases, they'll be lucky to find anyone that is able to really care for them at the standard and level that they need to care.
Hellosmile is a pediatric healthcare startup. There are 11 locations throughout primarily low-income neighborhoods in New York City. Hellosmile says 70% of their patients are on Medicaid and the Children's Health Insurance Program, known as CHIP.
You've got, these thousands and thousands of kids that you're helping.
50,000 a year.
50,000 a year.
This would have not been possible had there not been Medicaid.
But under the Trump administration, the future of these programs and the future of Hellosmile is uncertain.
This is Silvana, right? Yes. Hi, how are you, King 5? All right, are you ready to get your teeth checked?
Were these families going elsewhere for pediatric dental care before?
Yes, in certain cases, and they were having a very disempowering and unsatisfactory experience. And in other cases, no, they could just simply not find anyone that actually took those insurances.
I think in these communities, what you have is a lot of frightened parents because the experience of getting care is scary. How do you make this experience a fun, happy family experience where people don't have to be afraid?
You're gonna go with my friend over here, Sam. He's gonna take pictures of your teeth, okay?
All right, thank you. 1, 2, 3. All right, put your head back.
What we realized was that if you can empower the parents and really get the message of prevention delivered, then you actually have a completely different conversation. And now you can actually have them look forward to coming.
So encouraging the preventative care versus
Absolutely.
reactive.
Yes.
Medicaid could look very different under the Trump administration. President Trump has said he wants to give greater flexibility to states. One way to do so would be to turn Medicaid from an entitlement program into block grants. States would get a fixed amount of money, the goal being that federal spending decreases over time. The big question is, how will states continue to cover the costs of those who need care? As state budgets are squeezed, it may mean they'll cut back reimbursement rates for providers like Hellosmile and take incentive away from businesses to care for those on Medicaid.
With the block grants, you're just gonna have less money for prevention. There's no way you're gonna have less dollars and have more flexibility. It just doesn't make sense. A child that sees the dentist twice a year, you're talking about a maximum of $200 a year of preventive cost. Now, a child that doesn't see a good qualified provider will end up having disease and will eventually go to the emergency room. Now, that cost is in tens of thousands of dollars, and we're all gonna pay for it as a society.
Have your patients and members of the community, have they come to you with concerns about what might happen federally?
Yeah, I mean, we're getting emails and calls, and any patient that comes in, are they like, are you guys going to continue to see us? And so it breaks our heart, and we're like, yeah, we're not going anywhere.
Everybody's concerned about not having insurance. So it's, when you have a small children, you always want to make sure that you have coverage.
Yes.
Thank you for everything.
As the richest country in the world, I would think the one thing that we could all agree on is that every child, regardless of race, religion, ethnicity, demographic, should have access to quality health care.